Do you want to increase your case acceptance without spending any more money? Well, then you're going to want to find out what I've got to share with you. Come right back. Hi, I'm Dr. Ginger Bratzel from New Patient Attraction Automation and gingerbratzel.com, where we help dental practices grow by getting and keeping more patients. And we do it easily and quickly, faster than you can do it alone. So each week I bring you strategies, tips, and systems on getting you closer to your ideal goal. And today we're talking about case acceptance, a topic I get a lot. So people will say patients just don't accept treatment, or they're more conscientious about spending money, or they're not like they used to be. Well, the truth is, yes, all of those are true. So your case acceptance has to be better. So let's talk about some psychological triggers with case acceptance. When, in your case, let's just use you as an analogy. Have you ever been sitting in a room and then got up to go to another room to do something, and when you got there you forgot? Yeah, me too. It happens to all of us. And it's not because we're forgetting and we're getting older, or we don't have early on-stage dementia. It's because it's a psychological trigger. So just like your computer forgets everything when you clean screens, when you get up and go to another room, there's a phenomenon in your brain. When you walk through a doorway, it wipes part of your memory. So that's why we forget. Once you move from one location of familiarity to another, your brain automatically forgets unless you've locked onto it. So when it comes to our patients, it's a similar thing. When we have them in the chair and talking about their dental needs, they're all yeah. Once we move them from that location to another, like the front desk, this beautiful treatment area, front desk, whatever it may be, they have cleaned the slate. So when their anxiety is higher and when you're more emotional, you have a bigger tendency to wipe everything out, because it's just a coping mechanism to let it go. So if you want to improve your case acceptance, you need to get really good and be able to presenting at the chair. So you might not be able to do all of it, but you need to do the bulk of it. So not only just diagnosing it with people on their back, leaning back, this is when you get eye to eye and talk to them. This is where you bring your front desk on. So if you have your walkie-talkies or a pager system or whatever, you physically go up and say, well, I'm going to talk to Mr. Smith about that crown. Have them get all ready and have them be able to come back very easily and get him. Because if you say, Mr. Smith, this is what you need, yes. Do you understand? Yes. He wants to get it done, yes. Well, if I can get Susie to work out the financial arrangements, would you like to get it done today, if it's same day dentistry, or next week, or the next week after that? And we get the yeah. Okay, Susie, come on in. There's no disconnection. Susie knows what's going on. She slides in there. We didn't lose it. So if you find your case acceptance seems high in the operatory, but then when you get up, nobody signs up, look into that psychological principle. The more you can bring the team back to the actual chair and not move the patient, the higher your results will go. And you can just move your next patient into another room, just revolve into another operatory. That's how you're going to be more effective. That's how you're going to get better case acceptance. Don't think that they're separate. They are together, and keep them together. So that's your mission this week. Go into looking at that and test that out and see how your case acceptance goes this week. Take care. This is Ginger saying goodbye.